Hello and Assalamu alaikum, ladies and gentlemen. Welcome to another exciting episode of the Swanky Doctors podcast. This is your host Ali Haider, and today we have a very special guest with us from the United States, Dr. Hassam Ali, who has completed his internal medicine residency from East Carolina University. He has recently got matched into the GI fellowship program in the same university. Dr. Hassam has been guiding and mentoring me since my pre-med days. So yeah, he definitely has a really special place in my heart. Dr. Hassam, welcome to the show and thank you so much for joining us today.
Uh, Thank you for inviting.
Let's start the conversation with a few very basic questions like where were you born and how was your early life like and where did you get your early education from?
So I was born in Bahawalpur city. Early education, I went to Dominican convent school, पहले 5 साल, फिर आर्मी पब्लिक स्कूल, और फिर वहीं पे एक गवर्नमेंट कॉलेज था सादी के जर्टन, वहाँ पे एफएससी की। फिर मैंने
Okay.
एंटी टेस्ट दिया। एंटी टेस्ट पहली दफ़ा दिया था तो मेरिट नहीं बना था, तो फिर मैंने कहा रिपीट करेंगे। मोस्टली लोग एक दफ़ा रिपीट एटलीस्ट करते हैं। दूसरी दफा
Mhm.
जब मैंने दिया तब भी नहीं बना। फिर घर वालों ने बोला कि चलो प्राइवेट करा देते हैं। लेकिन मैं कहा चलो प्राइवेट नहीं करना। फिर मैंने तीसरी दफा दिया तो तब मेरा मेरिट बन गया। सो देन आई स्टार्टेड गोइंग टू काजाजा मेडिकल कॉलेज, क्योंकि वो मेरे घर के करीब था, तो आई जस्ट वांट टू स्टे इन द सेम सिटी।
So as you mentioned that you repeated the MCAT thrice, right?
3 times, yeah. The third
It's
time I
it's
got
a
in,
lo-
yeah.
it's a long duration and
Yeah, it's
how
a
did
long, like I don't think I think that time, okay, the main thing that hurts you is like you see जो आपके साथ पहली दफा में चले गए थे, they are like third years when you're starting first year, right?
exactly?
Yeah.
So
However, like
Mhm.
looking back now, when I see myself, I would be finishing my residency at the same time or maybe earlier than most of them,
Mhm.
because the time is less, and the FCPS part too, how difficult it is to pass it for most people just because of how it's designed compared
Mhm.
to American boards.
So okay, so during that week, did you try to explore career options other than medicine, or
So
you
I tried
stick to?
I tried doing ad math. I
Okay,
did like 2 months or 3 months. I couldn't do it. So I said, okay,
okay,
this is it. If I can just do it, that's it. If I cannot, I will just think about something else. But at that time, when I was in third time, I kind of knew, because I was kind of knew like this time I will make it.
okay. So what's the inspiration behind joining medicine and all this hard work?
So I think my mother, mostly because we grew up watching her. She comes from like she's a very self-made person.
Okay,
So I mean, we grew up with like, I would not say golden spoon, but at least a silver spoon, like, because
okay.
she did all the hard work. And so
She's a
my
doctor as
father
well,
as well.
right?
Yeah, she's a gynecologist. I mean, now she's retired.
Okay,
And same for my father too. He's a college professor. Now he's also
okay.
retired. So both of them, came from humble beginnings. So
Mhm.
that kind of like showed us like, okay. And then when you grow up, like in where I grew up in Balpur Victoria Hospital, there's like the housing for physicians.
Okay,
So a lot of you grow up watching physicians. So you kind of like,
okay.
okay, this is what I know and this is what I want to do. So I didn't have like any grand plans to do something else. I just, this is what I saw and this is what I wanted to do. That's it.
Okay.
Yeah.
So, how was the life like in the med school, and what were some of the extracurricular activities that you were involved in?
So initially, I was not involved in anything except like just showing up, because I was just excited to be there. I worked like 3 years
Okay.
for this, so I was just
Yeah,
excited to
exactly.
be there. And then we had like friends groups and stuff. But I think later, like my fourth year, final year, I was active. We had a dramatic society, which I think I did mostly the media part. We organized some
Hmm.
stuff. We organized fun fairs and stuff. But that was like the most I did. I didn't. I used to play squash with a couple of people.
Okay.
I love going to the gym. We had a good gym there in QMC, so I love going there. And
Hmm.
I guess that's about it. But I like the Quaidians Dramatic Society. That's why I did photography for them because I like photography.
Hmm.
Uh, I made videos for them. I used to do some graphic designing for them, and
Hmm.
that's when I also started doing some freelancing as well. Many people they just think of just one thing. Okay, medicine में है, medicine करनी है, that's it. But that's not how it's supposed to be. You can, make some money on the side when you're doing your med school and stuff. So I
Okay,
started
this
doing
is
freelancing as well.
this is an interesting part. So
Yeah.
when did you? Okay, okay. So when did you started your MLE journey, and how did you find the right guidance for the step one and further steps?
Yeah. So I would say that in my fourth year, I
Hmm.
did not know what USMLE was. I honestly, unlike Assam, I did not know, but I only knew what is PLAB. I wanted to do PLAB. Some of my college seniors they did PLAB and they were doing okay. So then starting final year or the end of fourth year, a couple of my friends they wanted to do this, and like we had like 7 or 8 seniors in total in the last like 15, 20 years who had given it. So I didn't reach out to them, but I just reached out to one friend who knew them. He said, "Oh
Okay,
yeah,
okay.
like Kaplan Parlo or ye Parlo." So I just Googled like everyone else. Actually, I think King Edward के blogs हैं जिस पे काफी information
Yeah.
है. Some seniors from there. So that's how I found out. Okay, this is what it is. So I started preparing the books, but I did not know the process of it. Like I came to know about the
Hmm.
process afterwards, like what else you have to do. So I
Okay,
studied
so
studied my Kaplan.
for all the juniors out there, can you please
Yeah.
briefly explain what MLE is and what's the entire pathway?
So MLE is basically like United States Medical Licensing exam. Even if you
Hmm.
do med school outside of US or inside of US, you have to give this test. And over the
Hmm.
years they have changed a lot. And there are like different steps that you have passed to get certification to apply into residency into the US. It does not mean you will definitely get residency, but it's part of the process. Once you are certified that you can apply for residency after you give these requirements and give these exams, you can apply for their uh, they call it the match. When you go through interviews, look at programs where you want to end up, and then make a merit list, and based off of how they like you and how you like them, kind of like match, and that's where the word comes from. But
Okay.
right now is I think a three-part process. COVID complicated it. It used to be simple. So now
Hmm.
basically you give your basic scientific exam, which is step one. It's I think a 9-hour exam. You have like some like 45 minutes of break time. Everyone can do it. That's not like the hard part.
Okay.
Then CK I think is also like I think CK is 9 hours and step one is 8 hours.
Okay.
CK is clinical knowledge, which is more of your clinical sciences, like final year subjects, if you don't have a modular system. And
Hmm.
then the complicated part is there used to be another like clinical skills exam, which they got rid of, which used to cost a lot of
Okay.
money, but now they replace it by different pathways. So if you have done house job, you have a PMDC license, you can just get certified after giving an English language exam like OET. If you have
Hmm.
not done house job, you have to talk to different physicians and have them look at you and look at your cases and how you talk to patients and stuff, and they call it mini clinical exam. So you can do
Okay.
that and then you can get certified. But these are all like well established and given in like many websites.
Okay. So as per current guidelines, you recommend
Mhm.
that one should do house job before applying for the match, right?
So I have always been pro house job. Even when
Okay.
before all these pathways started,
Hmm.
I'm always been pro house job because it just gives you like that 1 year of experience when you come here. It just means a lot.
Okay.
You just have an edge on everyone. You're because clinically you're always good. The only thing that IMGs struggle with is getting to know the system. So
Okay.
that will give you a strong edge. Obviously, if for example you don't require visa, you're a US citizen or something like that, you can come and go easily. Just come here, do 6 months or 8 months of electives or whatever and see if that
Okay.
helps. But if you cannot do that, you're just like me, then probably do house job and learn from there.
Okay, so ठीक हो गया, ठीक हो गया. So
Mm-hmm.
after graduation, you had two options, either to go for PLAB or MLE. Then why did you choose
Mm-hmm.
MLE जबकि आपको इसका knowledge नहीं था इतना?
So it was more challenging. So I was like,
Okay,
okay, let's see, कर सकते हैं कि नहीं. That's the only
okay,
reason. There was no other big reason. That's it. It was the harder thing to do as any brown person. You always want to do comparative stuff. That's how our
okay,
parent taught us, and every one person wants to match into cardiology, gastroenterology. They want to do comparative stuff, and that's it.
okay, okay.
Yeah.
So what's the entire cost of this MLE pathway, and how can we manage finances during these hard times? Because I remember
Uh,
a few months back you mentioned a story about your friend who covered the entire cost of MLE just by freelancing.
yep, yep, yep. So, I mean, emotional cost is a lot, but financial cost, I think right now is, I will just talk in US dollars because Pakistani currency की money depreciation बहुत low, बहुत ज़्यादा हो गई है. When I
Yeah,
when I
exactly.
gave step one, dollar was 116, and when I gave CK, dollar was 130, and it was then stable for a while.
Hmm. Hmm.
So, but now it's almost 300. You know.
Okay. Yeah.
So in US dollars, if you just account for exams, those
Hmm.
exams are going to cost you less than like around $5,000, including study
Okay.
materials and everything.
Hmm.
When you
Hmm.
account for coming to the US and doing rotations, that's a different thing because you have to buy tickets. Depends where you stay, depends
Hmm.
where you're doing your rotations, whether they ask you for money or not. So
Hmm.
that can cost anywhere from 10 to 15,000. It still can be done
Okay.
like under $15,000. And
Okay.
then making $15,000 is not as difficult as people think. Yeah.
Okay.
So I met a friend when I was doing, I came here to do CS, my clinical skill exam जो कि अब खत्म हो गया, back in December
Hmm.
2018. So I came here, I met a guy who was like a 2013 old grad from Sims, Wakaspa. He's a very, very good guy, very nice guy, very humble guy. So he said
Hmm.
like he didn't come from a very rich family. He started doing freelancing like on Fiverr, on Upwork, and he started writing articles and like, medical related stuff. And then he earned
Okay.
all the money from there. And then he got married here, he came here, and he still did it. And he earned like a bunch of money to pay for his exams. So when
Okay.
after this I found out like after I went home, I said, okay, I will try this too. Just because आपके पेरेंट्स से थोड़ा सा बर्डन चला जाता है. Like बच्चा वो फीस ही भरे हैं तो चलो यहाँ आने का वो खर्चा है वो आप खुद निकालो. So I also
Okay.
started doing this on Fiverr. I like it. I have tried Upwork, which is another website. I never liked it, and I introduced my
Okay.
younger brother to it as well. So
Hmm.
I wrote articles. I looked at personal statements, curriculum vitae, just like medical related stuff. And then I think when I earned was like $6,000 from it.
Okay.
So
That's a
जो कि
that's a
मैंने
good chunk of money.
yeah, after I came to US, I had to stop it because when you're on a certain type of visa, you cannot work for other people. So
Okay.
I ended that. Yeah.
Okay. So now coming towards the steps only details. So what's the
Hmm.
appropriate timeline for giving steps? Like what do you recommend to
Hmm.
all the medical students who are planning to pursue a career in medicine
Yeah.
in the specifically in the US? So what should be the appropriate timeline for giving steps?
Yeah. So if I could go back and do it all over again, I will
Hmm.
give my step one in fourth year, give my
Okay.
OET if now you have to give OET in the beginning of final year, and then
Hmm.
before final year ends or like just beginning of your house job, I will give CK. And then
Okay.
you do your house job. You can take a break, go to the US if you can, do rotations. If you cannot, just apply from home.
Hmm.
That's the simplest way to put it. Although
Okay.
जितना भी आप late हो जाओ, it's never too late once you do it. There are older IMGs, there are people who just graduated and matched. I have friends in New
Hmm.
York who are like 25-year-old and doing second year, third year of their residency. So you can just
Okay.
graduate and do it. But I would say ideally step one in fourth year, CK in final year, and OET in final year. I,
Okay.
I
Okay.
personally gave my CK in house job. So even if you're doing your house job, no matter how tough it is, I can tell you it's not that tough. You can give your CK in-house job.
Okay, okay, that's great.
Yeah.
So recently, the step one has become pass fail, right?
hmm
So do you recommend buying UWorld for preparing step one, considering it's just pass fail? Can we go for the offline Q bank for MLE
So
prep?
I would always say online one because it keeps giving you feedback, and then they constantly update it. You
Okay,
can use offline because but thing is $400 या तो बचा लो या फिर अगर एग्जाम खुदा ना खासा फेल हो जाए then it's over.
yeah, exactly.
For us, for people like at least अगर आप वीजा चाहिए हर चीज चाहिए, you have to be pristine. So
Hmm.
previously there were scores and now the scores नहीं pass fail you cannot fail it. So I would recommend
Okay.
online because they keep adding questions. One example would be when I started CK, it was 1800 questions, and by the time I finished my exam, they increased it to 3800 questions. Now it's 4300 questions. So
Okay.
I would say buy maybe 3 months, and pay or then do it.
Okay. Now, please tell us about the importance of doing electives in the US and what was your strategy of finding those electives?
Okay, so I mean, important part is it's a requirement to and it's an experience. Requirement is you need at least three letter recommendation that US physicians write for you that this is a good person, he's a workable person. It's not like they
Hmm.
वो ऐसी तारीफें करने लगते हैं. It's just like they wanna make sure that you is a reasonable person.
Okay.
So and then you also get to see US system.
Okay.
On the other hand, it's also so you get your letters and you get the experience. That's it. It's just most people they just do it for that. I did
Hmm.
not do electives. I applied for them, but
Hmm.
I just didn't apply sooner, I think. So I couldn't get the spot. So I did observerships. When I came here for my
Okay.
clinical skill exam, we were preparing and my made some friends and I didn't have any like specific observerships. So they told me about a person. So I actually physically went there and talked
Hmm.
to him and said if I want observership. So I got one, and then I met couple of other people there. So I went to the other people, and then you don't have to be shy. You have अगर आपने मैच करना है थोड़ा बेशरम होना पड़ता है, ठीक है? So
Okay.
I just went to the other person while he was doing a cat for a patient. So
Hmm.
cardiac cat. जब cardiac cat से फारिग हुआ तो मैंने कहा क्योंकि मैंने रोटेशन करनी है यहाँ पे. So उसके
Okay.
पास से मैंने की और फिर एक बंदे और के पास मैं personally गया. Don't bombard people
Okay.
with emails, but if you can physically get in touch with them, that's the best thing.
Okay. Was all these electives or observerships paid or did you get them for free?
No, it's all free. I never pay for anything. No, not for this.
Okay.
अगर अगर आपके
Then you
दरख्त
were
पे
then you
पैसे
were lucky, right?
अगर आपके दरख्त पे पैसे उग रहे हैं तो go for it. Yeah, if you're a US person, go for it. But if you can afford, go
Hmm.
for it. If you cannot afford, then there are people who will give you because वो मेरी तरह
Hmm.
ही है, ठीक है? They will give you and they have gone through. If when I am allowed, I will give people observerships. My hospital
Okay.
allows. I want to take money. What's the point of $500 या $1000 किसी लेने का? So
Yeah.
that's just bullshit. So these people from Aachen, they were very helpful,
Okay.
and they gave me good
Yeah.
observership.
AKU has a very strong alumni.
Yeah, they're very good. So I actually never and even my QMC people, some of them are very good, but they don't do as much academic as Aachen people. But you want to end up in
Hmm.
academic places, so you want to get observerships or letters from them.
Yeah. Okay. So, what are some of the tips to cut down the cost of MLE?
So one thing is increase your revenue. When you're a student, you have 5 years, not just doing this,
Hmm.
studying. You can do some work, do some online
Hmm.
work. अगर आपको बाहर जाते शर्म आ रही, do some online work. There are many jobs.
Yeah.
So I would say that's how you can. First year में से आपको पूरी कोई job ना आए, second year ना आए, third year में आपको कुछ ना कुछ आने लग जाएंगे. तो
Hmm.
एक एक चीज तो ये है. सेकेंडली
Hmm.
कटिंग कॉस्ट ऑब्जर्वरशिप के लिए पैसे कभी नहीं देने. ठीक है. देर आर
Okay.
पीपल आउट देयर हु विल गिव इट यू फॉर फ्री. आई कैन टेल यू लाइक व्हेन आई वाज लुकिंग फॉर अ रिसर्च पोजीशन, I did get it, but I
Hmm.
didn't do it. I sent around two. I exactly remember the number. I sent 2,658 emails to different physicians.
Okay.
So I got 100 replies, and one guy said, "Okay, come to me and we will interview." And then he offered me a research position at MD Anderson, but I couldn't because it was initially unpaid, so I couldn't afford it.
Okay.
So
Okay.
send more emails. It's just cold calling. You have to reach out to
Okay. Yeah.
people. Some of them will give you free observership. So you don't always have
Mm-hmm.
to do, that's the main cost. Otherwise, जब आप यूवर लेते हो, try to buy it for just 3 months एंड पे, ताकि आपको 6 months के लिए
Okay.
पैसे ना भरने पड़े. जब आप
Okay.
प्रैक्टिसिंग एग्जाम करते हो, just look
Mm-hmm.
at which exams are the best. Just give one or two online ones, not like सारे online खरीद रहे हो. ठीक है? If you
Mm-hmm.
can afford it, it's okay. But cutting costs, that's what matters. Also, see which exams are more good. Like for example, when I gave steps, NBMEs were better for step one, but UWSS, UWorld के साथ जो assessment exams आते हैं, they were better for CK. But now it may be
Okay.
different. So you just have to look in the internet and see.
Mm-hmm. सही हो गया. So what helped you in getting matched at your dream program and that too in the first try?
Uh, So I think it was a lot of things like when you look at the CV,
Mm-hmm.
I think I checked all the boxes for the people here.
Mm-hmm.
Like I my scores were okay. I had US rotations, like letter recommendations were good, and I was a graduate under 3 years. And then I had experience. Like my CV was not empty. I did not sit down and study for exams. So जब मैंने हाउस जॉब की,
Mm-hmm.
मैं यहाँ पे आ गया. मैंने रोटेशंस की, मैं वापस चला गया. मैं वहां पे चला गया तो मैंने कार्डियोलॉजी में जॉब की 6 महीने.
Okay.
फिर मैं मैच के लिए अप्लाई करने यहाँ आया. मैच करने के बाद, इवन दो आई मैच, आई वॉज फॉर 3 months आई वॉज अ न्यूरोसर्जरी रेजिडेंट टू
Okay.
द डे आई केम हियर. सो देर इज नो गैप इन माई सीवी.
सही.
This is a very, very important thing. People take 1, 2 years to give steps. Anyone can score high if you have 2 years.
Mm-hmm.
It's about like scoring properly when you are doing other things, ताकि आपकी CV में gap ना हो.
Okay.
And the last thing which is very important is these things can get you an interview, but to match, you should be a reasonable person.
Okay.
अगर मेरे प्रोग्राम में कोई एक बंदा ऐसा है जो थोड़ा चला हुआ है, सारा प्रोग्राम की डायनामिक खराब हो जाती है. सो व्हेन दे एक्चुअली लुक एट हंड्रेड्स ऑफ कैंडिडेट्स,
Mm-hmm.
प्रोग्राम के अपने क्राइटेरिया भी होते हैं, बट इन द एंड दे आल्सो लुक फॉर अ पर्सनेबल पर्सन.
Okay.
दे वांट टू वर्क विद अ पर्सन जो जो नॉर्मल हो.
Okay.
सो सो या.
Okay, so as far as I know, you have got a really strong research portfolio as well. So when did you get into research, and where did you learn all that technical stuff?
Okay, so research wise, I this is like I couldn't piggyback on anyone else because our people, my QMC people didn't do as much research.
Mm-hmm.
So I actually, thankfully I caught this early on, like in my house job, जब मैं सीके दे रहा था, we had a good case. I was like, okay, मैंने steps के लिए apply करना है, so maybe I should write this up.
Mm-hmm.
So I started like reading case reports
Mm-hmm.
and learning how other people wrote it. So I wrote this one and published it.
Okay.
And it takes like, good 3, 4 months.
Mm-hmm.
So I kind of liked it. Then I started doing like more stuff, looking at how other people publishing, so reading their work and see if I have a similar research question.
Mm-hmm.
So based on their methodology, I can apply my research question and do it.
Okay.
So I started doing that. फिर case report, that's the most thing I did while I came here in residency intern year.
Mm-hmm.
जब intern year में आया तो मैंने कहा अच्छा review article, like systematic reviews, just YouTube read and saw like कैसे करने हैं.
Okay.
The hard part was learning how to do analysis.
Mm-hmm.
So that was is still a learning process, but it has been 2 years since
Mm-hmm.
I regularly look something up every day almost,
Mm-hmm.
just to see कि किस चीज को एनालाइज कैसे करना है, स्टैटिस्टिक्स कैसे करनी है. I can write code for Stata, which is like similar to C, and I'm trying to learn some other languages too. So this is just like अपने शौक पे है.
Okay.
In the end, like it's the destination what matters. So if you are just looking to publish for the sake of match, is different. For me, it was different because I like it.
Okay.
You
Okay.
know, so I just had that motivation.
Okay. Okay. So now please tell us about the your overall experience of doing IM residency from East Carolina University, and how is it different from residency in Pakistan?
Okay, so I love it overall. Yeah, but being said that, different from Pakistan and different from other programs too. Like when I was ranking, I had a couple of more bigger
Mm-hmm.
programs, but I did not want to end up there because it was too
Okay.
cold and the people were too
Okay.
cold. Here, in the south, लोग थोड़े हमारी तरह ही हैं. Like हाल चाल पूछ लेते हैं इसमें, and the program still a university program has all the fellowships, so I
Okay.
ended up there. It was my first rank
Mm-hmm.
actually. So comparing from Pakistan, मैं पाकिस्तान में कर रहा था like न्यूरोसर्जरी रेजिडेंसी, और देन कार्डियोलॉजी में मैं
Mm-hmm.
मेडिकल ऑफिसर था. So the thing is, professor का
Yeah.
एटीट्यूड. प्रोफेसर का एटीट्यूड है, आ रहा है, सारे एसआर उसके पीछे लग गए हैं, पीजी उसके पीछे लग गए हैं, एक प्रोफेसर है वो उसको भी बड़ा हाई
Mm-hmm.
मिल रहा है। एंड देन द एजुकेशन वाइज कोई नहीं, अगर एजुकेशन हो रही है तो बड़ी नेगेटिव रीइंफोर्समेंट है, 4 रुपए फेंके जा रहे
Yeah.
हैं ये वो। So I just didn't like it,
Okay.
you know. And then I didn't think I was learning
Mm-hmm.
enough from it, you know. और फिर सबसे, I mean, you can self learn, but when you come to US, you know कि असल learning क्या होती है, और like how you can apply that knowledge for
Mm-hmm.
patient care, you know. वहां पे तो बस ये सर में दर्द है, टाइलेनॉल दे दो, कोई नहीं देख रहा कि क्या करना है। इमरजेंसी, आई मीन इट्स नथिंग टू डू विद पाकिस्तान, ट्रेनिंग स्पेसिफिक पेशेंट लोड बहुत
Okay.
ज्यादा है। तो बट ट्रेनिंग फ्रॉम यूएस एंड गोइंग बैक टू पाकिस्तान, दैट इज ऑल्सो हार्ड, बिकॉज आप एक सिस्टम में ट्रेन हो जाते हो और आप पाकिस्तान में ट्रेनिंग फिर आपको जरा अप्लाई करना उसको थोड़ा मुश्किल होता है, बट स्टिल आई वुड से इट इज
Mm-hmm.
बेटर। एंड देन यहाँ पे लाइक आपकी डायरेक्टिक्स लाइक एजुकेशनल स्टफ आपको रोज पढ़ाएंगे, इट्स नॉट लाइक अ जॉब, जस्ट लाइक अ
Okay.
जॉब, इट आपको पढ़ाई भी करेंगे। आपके हर साल जिस तरह स्टेप्स होते हैं, हर साल मैं एक 9 घंटे का एग्जाम देता हूँ, इन ट्रेनिंग
Okay.
एग्जाम, टू मेक श्योर माई
Okay.
प्रोग्रेस इज गुड, सो आपकी आपकी एग्जाम से जान नहीं छूटती।
Okay.
ये हाँ। सो एंड देन आपकी पेशेंट लोड, आपको ये नहीं कि हजारों पेशेंट दे दें आपको, लेकिन 10 20 जितने पेशेंट दे रहे हैं आपको उनकी केयर करनी है, बट उनके साथ आप लर्निंग भी साथ कर रहे हो, प्रोसीजर वाइज इज गुड, आपके पास सारी
Mm-hmm.
फैसिलिटीज होती हैं, तो आपको पैसे ज्यादा
Okay,
मिल रहे
okay.
हैं।
Dr. Hassam, I read your research publications every now and then, and no doubt you are doing an amazing job. But as far as I know, your prime interest was in cardiology, right? But you recently got matched in GI.
Mhm.
Like, how did that happen?
Yeah, yeah. Okay, so this is a very deep question. As every brown person, I wanted to do cardiology
Okay,
initially. लेकिन जो मैं पाकिस्तान में मैंने 6 महीने की, आई डिड नॉट लाइक द
okay.
कल्चर, इट वाज जस्ट नॉट गुड। So, but I was still wanted to do cardiology. I was like, maybe in US it would be
Mm-hmm.
different. So I came to US, did my 3 4 months of rotations, all in
Okay.
cardiology. People were nice, but the culture was the same, क्योंकि सारे ब्राउन लोग कार्डियोलॉजी करना चाहते हैं, तो मेरे ख्याल है वो पाकिस्तान से इधर ले
Okay.
आए हैं। तो फिर मैंने कहा चलो छोड़ो, मैच हो जाते हैं ना, जब मैच होके देखेंगे, मैच हुआ ब्लॉक 1 पहली रोटेशन कार्डियोलॉजी इन पेशेंट, मैंने कहा चलो ठीक है, बट इट वाज जस्ट एट दैट टाइम, इवन दैट टाइम आई वाज कंफ्यूज, ओके शुड आई डू दिस, बट आई वाज लाइक अगर मैं ये नहीं करूंगा तो और क्या
Mm-hmm.
करूंगा, So I was like, okay, my brown genes say I have to look for another
Mm-hmm.
competitive thing. So I said, okay, let's do gastroenterology. So मेरे program में gastroenterology, people were very nice, very friendly, हंस के आ रहे हैं, खुशी से आ रहे हैं, मुंह नहीं बना हुआ किसी का। So I was like, why not? I should do this. And actually, gastroenterology maths from the last 5 years is more competitive than is the most competitive for IM subspecialties. So I did not have the CV for that initially, my
Mm-hmm.
intern year. And I was thinking it is too late to apply.
Okay.
लेकिन फिर मैंने जब काम शुरू करना किया उस पे, मैंने वॉलंटियर किया अपने डिपार्टमेंट, बिकॉज आई हैड अ बिग थिंग, बिकॉज मेरे अपने इंस्टीट्यूट में
Okay.
फेलोशिप है, यू नो सो मुझे मैंने वहां पे काम शुरू, अपनी शक्ल दिखानी शुरू कर दी, काम करना शुरू कर दिया, रिसर्च वर्क आई डिड ऑल ओवर, अटेंडेड कॉन्फ्रेंसेज, आई डिड लाइक लास्ट ईयर एक्चुअली, सेकंड ईयर डिड अ वर्क, आई डिड नॉट हैव एनी वेकेशंस, लाइक मेरी जो भी 1 महीने का रिसर्च ब्लॉक था, या जो वेकेशन टाइम था, आई लाइक वर्क लाइक क्रेजी।
Okay.
और आई वॉलंटियर करा था ये वो, सो आई न्यू के फिर इसी बेस पे आई जस्ट लाइक इट। एंड आई गिव दिस एग्जांपल, both cardiologists and a gastroenterologist can own a Porsche, but only gastroenterologist gets to
Okay.
drive it because cardiologist doesn't have the
Okay.
time for
Okay.
it, you know. So आपको पैसे भी उतने मिल रहे हैं, there is good amount of research in it which I wanna
Mm-hmm.
do later on
Mm-hmm.
if I can. There are good amount of procedures in it. There's not just not endoscopy, colonoscopy. There's stenting and lot of
Mm-hmm.
advanced procedures. There's motility, all acute pancreatitis,
Okay.
like bunch of stuff. So I just fell in love
Okay,
with it.
that's great. So, Dr. Hassam, you
Yeah.
run an online blog as well named as USMLE for Quaidians, and no doubt it has helped me a lot.
Mhm.
I would like to know that how did that start?
आई थिंक सो, जब मैं स्टेप वन ने करा था, जब मैंने स्टेप वन दे दिया तो कोई सीनियर से इतनी गाइडेंस
Mm-hmm.
नहीं थी, 5 6 सीनियर वो खुद भी अपने मैच में लगे हैं, उनका मैच नहीं हुआ। सो कोई हमारे गाइडेंस नहीं थी अपने
Mm-hmm.
क्यूएमसी के लिए, तो मैंने अपने क्यूएमसी के लिए वेबसाइट लिखी थी बेस्ड ऑन माय
Mm-hmm.
एक्सपीरियंसेस। बट रिसेंटली आई थिंक आई टेकन इट डाउन बिकॉज नाउ इट्स बीन 8 years since I wrote it, or like not 8 years, okay,
Mm-hmm.
6 years. So I think now it's
Okay.
outdated. So I just don't want to misguide. Yeah, actually, today someone messaged me like why you took it down or like why you because I deleted the highlights from my Instagram as well.
Okay.
So I just told them just I don't want to misguide anyone because things have changed
Mm-hmm.
now. So I just don't have that information
Mm-hmm.
anymore, you know.
Sahi.
But
Okay.
yeah.
Can you please tell us about a particularly rewarding experience that you had during your medical training? Like it has been like 7 to 8 years into medicine. Uh, I know बहुत सारे
Hmm.
experiences होंगे लेकिन कोई एक particular जो आप share करना
Oh, bro, yeah, ये तो interviewer question
चाहें.
है. I mean, when you get your first paycheck, it's rewarding for sure.
बट वो आपके लिए इतना नहीं होएगा क्योंकि यू आर ऑलरेडी डूइंग फ्रीलांसिंग तो मेरा नहीं ख्याल वो इतना चार्मिंग होगा आपके लिए.
Yeah, I was doing free. I actually earned less than I was. Yeah, that's true. But patient experiences, I mean, you can okay. So this is more in third year actually when you can figure out something that was missed by a couple of
हम्म.
people. Younger, so that is always rewarding. Like I think one time this patient had
हम्म.
hyponatremia, so I think it was because imioridone induced, which was interesting. So I caught it early on, and then we stopped it and fixed that patient up. A couple of other things too, like bunch of zebras. When you see zebra is like a term यहाँ पे अगर आपके पास कोई बहुत rare
ओके.
diagnosis हो, so if you can catch a zebra, it's just rewarding. And I think the most rewarding thing is clinic में जब एक patient का है, okay, I want to change my primary care physician to
ओके.
you, so that is always
या
good.
या.
So you kind of know that you're doing
हम्म.
something right at this time. Obviously, it's you have your good days and
हम्म.
bad days, but you cannot let it affect your job. Cause यहाँ पे आके कुछ लोग ऐसे ये भूल जाते हैं कि in the end it's not just a training, it's a job too. You get paid for
हम्म.
this. So you have to show up on time and
या
do
या.
your work.
ओके. सो नाउ बस इसको कंक्लूड करेंगे. Few last questions. How do
Mhm.
you see the future of doctors, and do you see doctors being replaced by AI anytime soon?
So good question. So I mean, no one knows what the future
Hmm.
holds. I can totally see AI being incorporated into the US
Yeah.
healthcare system, especially because US healthcare is very
Hmm.
insurance based. So there are already companies hiring which want to test their AI programs to see क्योंकि आप यहाँ पे पेशेंट के लिए कोई आप दवाई कराना चाहते हो इंश्योरेंस पे कोई किसी इंश्योरेंस जब इंश्योरेंस का आप रिक्वेस्ट भेजते हो वहां पे कोई एक फिजिशियन बैठा होता है वो देखते हैं पेशेंट को ये दवाई चाहिए कि नहीं चाहिए और इंश्योरेंस कंपनी को कितने
Yeah, they
पैसे
will
पड़ेंगे इसके लिए
always.
सो
Yeah,
नाउ दे आर
yeah,
टर्न
yeah.
एंड
They will
रिप्लेस
always try to cut
या
down the cost.
exactly. So now they're trying to replace those physicians by
Hmm.
AI, because it's just looking at
Yeah.
data points. They haven't seen the patient. So AI can look at data points better than any
Hmm.
person. So it's totally, but I think it may replace some
Hmm.
aspects of it, but definitely not the human part. I mean, AI is already, if you do a colonoscopy, there are many hospitals, even I think our outpatient department has AI in it, like which can totally see the polyps in the
Hmm.
colon. If you're doing get a radiology report or a ECG, AI also reads it, and then a physician has to
Okay.
proofread it. So maybe 20, 30 years from now, when people mentality change and they want to trust
Hmm.
AI more, however, there's still gonna be,
Okay.
issues.
Okay. So,
Yeah.
one last question. What's the last piece of
Mhm.
advice that you would like to give to someone who is planning to pursue USMLE?
I say like start
Hmm.
early on and look at the whole
Hmm.
CV instead of just looking at like one aspect like scores or
Hmm.
something. People forget that it's not just the scores. You have to present yourself as a whole CV, like that's a whole
Hmm.
person. So start early and work on your CV, not just your scores.
ओके ओके. डॉक्टर साहब मुझे अभी एक और क्वेश्चन मेरे जहन में आया है वो मैं पूछना चाहूँगा.
Uh-huh. Yeah.
Okay, okay. So, what are some of the voluntary experiences that you had during your MBBS वाला course? Because यहाँ पे voluntary वाले जो आपके पास experiences के chances होते हैं वो बहुत limited से होते हैं. So, please shed a light on that
Uh-huh.
part.
तो आई थिंक हमारे क्यूएमसी में एक सोसाइटी थी ब्लड वाली उसके लिए थोड़ा बहुत काम मरीजों के लिए
Mm-hmm.
ब्लड ले लिया यूएस के अंदर मैंने ज्यादा किया लाइक आप यहाँ पे आके कम्युनिटी केयर क्लिनिक्स होते हैं जैसे हमारा एक पिट काउंटी कम्युनिटी केयर क्लिनिक यू कैन गो देयर ऑन संडेज
Okay.
एंड एवरी अदर
Mm-hmm.
वीकेंड एंड ट्राई टू
Mm-hmm.
वॉलंटियर I try to. What else? I think that's about it. Not a lot of volunteer work.
Okay. Okay.
Yeah, but I think those two. I mean, anything you do, जो अपनी सीवी पे आ सके, maybe for even अगर आप लोग 4 दिन के लिए भी गए हो, it's still a volunteership. Just put it on अपने सीवी
Okay.
पे.
Okay. Here I would like to end
हाँ,
the discussion and thank you, Dr. Hassam, for sharing your insights with us. And it was an
हाँ,
amazing session और मुझे यहाँ पे बहुत कुछ सीखने को मिला. Thank you so
हाँ.
much for your time and
Thank you for having me.
you are welcome, Dr. Hassam. Thank you so much to all the viewers who have watched the episode till the very end. Join us next time for more exciting conversations. Until next time, Allah Hafiz.